Introduction to heart failure. Heart failure occurs when the heart cannot meet the demands of the systemic circulatory system. The ventricles may not fill properly or may not pump blood effectively. As cardiac output decreases, the body receives less oxygen and nutrients. Fluid begins to back up into the lungs or throughout the body, depending on which side of the heart is affected. Heart failure is progressive and can severely affect a client's quality of life. Sense. Pathophysiology of heart failure. The failing heart becomes an inefficient pump. Problems occur when ventricles do not fill properly, ventricles do not eject blood effectively, decreased cardiac output causes poor perfusion to organs and tissues. The body attempts to compensate by increasing heart rate retaining sodium and water activating stress hormones. Over time, these compensatory mechanisms worsen heart failure. Fluid overload develops, leading to pulmonary edema, peripheral edema, and organ congestion. Risk factors for heart failure. Common risk factors include family history of heart disease, coronary artery disease, hypertension, diabetes, obesity, chronic pulmonary disease, chronic infection, metabolic disorders, alcohol abuse, cardiotoxic medications or agents, NCLEX, CLU, hypertension, and coronary artery disease are two of the biggest causes of heart failure. Impact of heart failure on overall health. Heart failure affects the client physically, emotionally, and socially. Clients may experience shortness of breath, fatigue, weakness, edema, difficulty sleeping, exercise, intolerance. Clients often struggle to complete activities of daily living. Many clients develop anxiety, depression, hopelessness. Frequent hospitalizations and chronic symptoms may greatly affect quality of life. Safety considerations. Clients should monitor daily weight, monitor worsening, edema, monitor shortness of breath, monitor oxygen saturation if ordered, teach clients when to report symptoms such as sudden weight gain, worsening, dyspnea, chest pain, increased swelling, teach proper oxygen use and medication compliance. Left-sided heart failure. Left-sided heart failure causes blood to back up into the lungs. This produces pulmonary congestion, common manifestations, shortness of breath, crackles, orthonia, paroxysmal nocturnal dyspnea, tachycardia, hypotension, pulmonary edema, fatigue. Clients may need multiple pillows to sleep. NCLEX clue, left side equals lungs. Right-sided heart failure. Right-sided heart failure causes blood to back up into systemic circulation. This produces body swelling and venous congestion. Common manifestations: JVD, ascites, peripheral edema, enlarged liver, enlarged spleen, weight gain, abdominal distension. NCLLX clue, right side equals body swelling. Biventricular heart failure. Biventricular heart failure means both sides of the heart are failing. The client experiences pulmonary edema, dyspnea, peripheral edema, ascites, fatigue, fluid overload. These clients are often severely symptomatic. Heart failure lab and diagnostic studies, BNP. B-type natriuretic peptide increases when the ventricles are stretched from fluid overload. Elevated BNP strongly suggests heart failure. Echocardiogram measures ejection fraction valve function and ventricular size. Chest X-ray may show cardiomegaly, pulmonary edema, pleural effusions. Cardiac catheterization evaluates coronary arteries pressures and cardiac function. Framingham criteria used to diagnose heart failure based on symptoms and findings. New York Heart Association classification determines severity of functional limitation. Role of the nurse in heart failure. Nurses play a critical role in monitoring and education. Assess ability to perform ADLs, oxygenation status, lung, sounds, edema, fluid balance, medication compliance. Provide teaching on daily weights, diet, sodium restriction, fluid restriction medications, oxygen, safety, nursing process, assessment, recognize cues by assessing, health history, lung sounds, heart sounds, edema fluid overload, daily weight, changes lab results, important findings, crackles rails, JVD, dyspnea, decreased exercise tolerance, nursing process analysis, analyze data for worsening manifestations, increasing edema, worsening crackles, weight gain, worsening shortness of breath, inability to complete ADLs, prioritize reducing fluid overload and improving oxygenation. Nursing process planning goals include improve cardiac output, improve oxygenation, reduce fluid overload, improve quality of life, reduce hospitalizations, teach medication adherence, fluid management, daily weights, diet modification, nursing process implementation. Interventions include high Fowler's position, oxygen administration, cough, and deep breathing exercises, monitoring lung sounds, medication administration, reducing anxiety, lifestyle modifications, monitor intake and output, daily weights, oxygen saturation, edema, respiratory status, nursing process, evaluation, evaluate whether the client breathes easier, has decreased edema, has improved oxygenation, maintains stable weight, has improved activity tolerance. Outcomes may be improved, worsened, unchanged. Non-pharmacologic interventions, lifestyle modifications are essential. Teach smoking cessation, weight reduction, stress management, moderate exercise, heart healthy diet, blood pressure control. Teach moderation of alcohol, caffeine, monitor fluid intake carefully. Pharmacologic interventions, ACE inhibitors, reduce afterload and cardiac workload. Example, lisinopril. NSLEX, CLU, watch for dry cough and angioedema. Angiotensin II receptor blockers, used if ACE inhibitors are not tolerated. Example, losartan. ARNEs, angiotensin receptor neprilysin inhibitors improve cardiac function. Beta blockers reduce heart rate and cardiac workload. Example, metoprolol and carvedilol. Aldosterone antagonists reduce fluid retention. Example, spironolactone. Hydralazine and isosorbide dinitrate decrease workload and improve blood flow. Diuretics reduce fluid overload. Example, furosemide. Monitor potassium blood pressure, daily weights. Surgical interventions, cardiac catheterization may identify coronary artery disease contributing to heart failure. Implantable cardioverter defibrillator, or ICD, prevents sudden cardiac death from lethal dysrhythmias. Biventricular pacemaker improves synchronization of ventricular contractions. These devices improve cardiac output and quality of life. Strain. High yield NCLEX review, left-sided heart failure, pulmonary edema, crackles. Orthopnea, dyspnea, right-sided heart failure, JVD ascites, peripheral edema, hepatomegaly. BNP, elevated in heart failure, daily weights, best indicator of fluid retention. ACE inhibitors, watch for cough. Diuretics, monitor potassium and dehydration. High Fowler's position, improves breathing. S3 heart sound, common in heart failure. End of lecture activity. Have students identify whether symptoms are left-sided or right-sided, priority nursing interventions, medications used for treatment, safety concerns, worsening manifestations. Example, client with crackles, orthopnea, pulmonary edema, and dyspnea. Correct answer, left-sided heart failure.